So what are people afraid of with hypnotherapy? What are they afraid of with hypnosis, more correctly?
Well, most people are afraid that hypnosis is going to make them unconscious and therefore lose control.
They're not going to be unconscious.
No, absolutely not. In fact, you are awake and aware the entire time. You can hear what I'm saying. You're not going to fall asleep. You don't go unconscious. For example, have you ever been, if you've been reading a newspaper or a book and you have to read the same paragraph 3 or 4 times? That's the opposite of hypnosis. And then maybe sometimes you're in the right frame of mind and everything's sinking in quickly and easily.
It's all crystal clear.
Right,
yes.
Exactly. That's essentially what hypnosis is. It's the state of mind in which...
Almost like a mental speed reading.
Right, exactly, where your brain can process information most efficiently.
Okay.
For example, if you've ever been reading a book or watching a movie that you're engrossed in and maybe someone calls your name and you don't hear it the first time, or maybe you're driving down the road and you zone out, you don't know how you got to your destination.
Yes.
Those are examples of hypnosis in daily life. My job is
So
essentially...
hypnosis occurs naturally in daily life?
That's right. Every day you go in and out of hypnosis. My job is to systematically access that state so that you can achieve your goals.
Now, where is that most helpful, Dr. Chris? Who are the... By the way, I'm sorry, we're talking with Dr. Chris Clayton. Dr. Clayton is a hypnotherapist. And let me just take a side note here for a second, Dr. Chris. There are people who claim to be hypnotherapists who've gone to, a one-day class or a 2-week school. You, in fact, are you have a doctorate in hypnotherapy. Are there a lot of schools granting those doctorates?
No, there's only one degree-granting school for hypnotherapy in the entire world, and that's the American Institute of Hypnotherapy in Irvine, California.
And you are a graduate of that school.
That's
correct.
But
don't you also have a degree in psychology, a PsyD?
Yep, a PsyD, which is a professional...
So you have a double doctorate?
Yep, exactly.
Okay. So people are afraid of losing control. They're afraid of being unconscious. What else are they afraid of?
Those are pretty much the main things. Once people understand that hypnosis, you don't lose control. It's just a normal state that you go into in which your mind is focused, kind of like meditation. As soon as they understand that, they're no longer afraid.
Are there any issues with which hypnosis is most effective?
Well, hypnosis, in my opinion, is most effective with neutralizing compulsions. Like if you ever feel compelled to do something, such as eat that piece of chocolate cake or smoke a cigarette.
No, that never happens to me. No.
So essentially what hypnosis can do is neutralize that compulsion so that you no longer feel motivated to go do that.
When you talk about compulsions, let's categorize what the most common compulsions you deal with would be.
Number one would be weight loss, compulsions to eat, also lack of motivation to exercise, also compulsion to smoke, whether that's cigarettes or other kinds of drugs, also drinking alcohol. Those are the main ones as far as compulsions.
So most of your patients or your clients are folks who are dealing with issues like that?
That's correct.
Yeah.
Yep.
Why is it that hypnotherapy or hypnosis has gotten such a bad rap over time?
Well, in the past it got a bad rap because we didn't understand it that well, so we had, stage hypnotists and people not using it correctly. But nowadays it actually has a good rap. It was accepted by the American Medical Association, the British Medical Association, and nowadays it's accepted as a bona fide method of treating compulsions and other
kind of like.
disorders.
Would you say that it's a form of alternative medicine, just to give it a broad category, not unlike acupuncture, acupressure, reflexology, kinesiology? Those things have a greater acceptance now as well.
Yeah, absolutely. And
does it fall into that category?
It kind of falls into that category, but it's actually even more accepted than those other methods nowadays. Nowadays, if you ask 10 doctors whether hypnosis is valid, at least 9 of them are going to say yes, hypnosis is valid. I have physicians referring to me all the time.
I've heard of people who, for example, have to do some fairly serious dental work, who go and are pre-medicated by being hypnotized. They're not medicated at all. They're hypnotized and undergo whatever it is that they have to go through, and don't feel any pain.
Yep, that's absolutely correct. In fact, if the person is allergic to the chemical anesthesia, hypnoanesthesia is the #1 treatment of choice for creating that numbness.
Now, my girlfriend, who also is a doctor, she's a psychologist, when I told her I was coming to do this program, I said to her, now, I think Dr. Chris could help you because she's a compulsive eater. Can you help somebody like that?
Yeah, absolutely. In fact, that's just another form of compulsion. When people are focused more on the taste of a food rather than how that food will make them feel, then number one, they're going to eat too much food, and sometimes they'll also eat the wrong types of foods.
We live in a world where people want instant this and instant that. And my understanding of the way this works is that unlike traditional psychotherapy, what you do has a relatively short tenure to it. It's not something that takes a long time to do. Is that correct
that's
as well?
absolutely right. In fact, it's normal in counseling or traditional psychology for the therapy to last 20 sessions or more. But with hypnosis, it usually doesn't last more than, say, 3 to 7 sessions, so it's very brief.
Our conversation with Dr. Chris Clayton will continue right after these important messages. Don't you go anywhere, because there may be a few of you out there who are having some issues with overeating or smoking, or you drink too much. Whatever your phobia may be, Dr. Chris probably will be able to help. Stay tuned. We'll be back.
Dr. Chris Clayton's practice is dedicated to helping people lose weight, stop smoking, eliminate phobias, control anxiety, and increase productivity.
It even helped me in other things because I stress about every little thing.
If anyone needed any type of help for any type of disorder or a problem that they had, I would surely recommend Dr. Clayton.
Hypnosis is affordable, requires no medication, is pain-free and non-invasive, and 9 out of 10 of Dr. Clayton's clients experience a positive result in 2 to 3 visits.
I felt that the results were immediate.
Since that one meeting, basically, I've gone from 2 packs a day to 1 a day.
Unlike diets, willpower, medication, and other forms of therapy, hypnosis is fast, totally safe, and relaxing. Call Dr. Clayton's office or visit the website.
He's able to accommodate my schedule after work.
What can hypnosis do for you? It can change your life.
And I knew that I was okay. I really knew.
We're talking with Dr. Chris Clayton. He's a doctor of hypnotherapy and a doctor of psychology. Is that correct?
That's correct.
How do those two mesh?
Well, the psychology helps me to have a broader understanding of the human mind and how it works. Hypnotherapy is essentially kind of the tools to put someone into hypnosis, and also the way to properly structure suggestions so that we can actually make the change
Is
happen.
this a fair analogy then, Dr. Chris? The analogy would be the psychiatrist diagnoses a person has an anxiety problem, i.e. he then, or e.g., he then prescribes a medication to deal with the anxiety. In your case, you diagnose the situation and then you prescribe hypnotherapy.
Yep, that would be a fair analogy. Also, maybe a general practitioner sends someone to a surgeon. So general practitioner would be like psychology, and the surgeon would be like hypnotherapy.
In your mind, what does close successfully mean?
Well, that essentially means that both myself and the client decides that the problem has been solved.
The problem has been solved.
Right.
Okay. Give me a case in point, if you would, please. Just one.
Well, one of my clients had a very unique kind of problem. She had problems swallowing, so that whenever she would swallow anything, even a grain of rice, she would start to gag. So she was essentially...
Oh my goodness.
Right, she was essentially limited to eating applesauce and milk all day.
I couldn't swallow anything, and I got to the point where I had stopped eating almost everything. I was down to just consuming tomato juice, tomato soup, and I was, very afraid of how it would affect my body, in the long run. So I went through the phone book and just started flipping through it, and I come across hypnosis. And I called the first number, which was Tidewater Hypnosis. I talked to Dr. Clayton, and he explained to me how it worked, and he would have me come in. I had about 4 sessions, and I was completely cured. Completely cured. I went from eating hardly anything, and my life is just back on track. I'm so much happier, and it's just, it's unbelievable. It was an unbelievable experience for me.
Can you imagine being in a situation, ladies and gentlemen, where you couldn't swallow?
Yeah, it was very difficult for her. She felt like she was
She
gagging.
must have been in a panic state.
Yep, she went to
continuously.
physicians, all kinds of specialists, and no one could find anything physically wrong with her. So she came to me. I worked with her for 3 or 4 sessions, and now she's able to eat whatever she wants. She's very happy, and so that's what I would consider a success.
What was the pathology underlying that? Did you?
I believe that the problem came from anxiety, and she had so much stress and anxiety in her life that the unconscious sometimes picks strange behaviors as a way to stimulate this anxiety. And in her case, for whatever reason, it picked disallowing her from being able to swallow anything other than liquids or things like applesauce. So for whatever reason, that anxiety caused that to happen, and essentially we used the hypnosis to eliminate the anxiety and kind of get her unconscious comfortable so that she was able to return to her normal behavior.
And actually, how long did it take before she was okay?
I think it took about 3 or 4 sessions. And this is after seeing physician after physician, specialist after specialist for months, and then I think I saw her for less than a month, and she's perfectly fine and very happy.
You treat a lot of different kinds of problems and issues that people have. What are the most common problems?
The number one problem that I treat is being overweight.
I started the hypnosis because I have been through every diet that you could possibly think of. You know, your metabolism does slow down as you get older, but it's not only that, it's your mindset. As a child, I like to eat, and as I'm getting older, the more I think about food, the more I want to eat it when I'm trying not to. Every diet, again, carb, South Beach, no food, everything I have tried. Self-esteem is mostly because of the weight, and again, it's things as my childhood that I just will not outgrow on my own. And I truly believe that Dr. Clayton could help me move on and not forget about my past, but restructure my past and my thought process towards it. I started reading a book on hypnosis, and that's what led me to call Dr. Clayton to discuss and see if maybe I could maybe change my life forever versus just a diet plan or, a psychiatrist or psychologist. I've seen Dr. Clayton 3 times, and what I really like about him is he explains things to you and teaches you the way that things should be, in real life. So I've been there, like I said, 3 times, and I've already seen a significant change in the way that I do have my eating habits.
A lot of people come and they eat the wrong kind of foods in the wrong amounts, and they don't feel any motivation to exercise. So essentially, I use the hypnosis in those cases to eliminate the compulsions to eat the bad foods in the wrong amounts so that they're eating foods that are healthy, that will help them naturally lose weight, and also gives them motivation to exercise. It's essentially a shift from focusing on how foods taste to how the foods make you feel, and also giving you a new motivation to go out and exercise, because your body actually feels better when you're exercising, and when people start noticing that, then they start naturally feeling motivated to exercise.
When doesn't hypnosis work? That's the question at hand. We'll be back with Dr. Chris Clayton, more about how hypnotherapy might help you with issues that you're having with overeating, smoking, drinking, whatever your issue may be. More when FYI continues on the other side.